Hi, so this video is to show you how to treat your feet using direct pressure and myofascial release principles, and I will describe the concepts of that at the end of the video so we can get right down to the business of how to do the techniques so that you can bring a lot of relief, a lot of ease and softness to those tender spots, those sore spots on your feet. If you have plantar fasciitis or any feet problems in general, then this is usually very helpful. If you have neuromas, you might not want to put the pressure right over the neuroma, but in Chinese medicine, the origins of reflexology actually come from the concept of wellness, where the bottom of the feet is mapped out the whole body, and stimulating or treating, massaging the bottom of the feet is a very helpful concept in general for wellness. So do it and enjoy it. Wonderful device is called a Nola roller. It's actually very good for the thoracic spine, but you can use a rolling pin or even a frozen water bottle. The point is that we can either do this one-sided or two-sided. Where sitting or standing, you can press your feet down onto these broad, firm pressure. You roll through the tissue looking for the area that's most tender. It's very good to sort of pull the toes up like this so that it puts the tissue underneath the feet on tension, and find the most tender spots and stop on it and wait. These areas on the ends of the Nola roller here and here are very good to, almost like a blade, come up between the bones of the toe in this manner here. You can do it on both sides at the same time if you need it on both feet at the same time, or else just on one side. It's quite tender if you need it, so just be gentle, be careful. You can kind of splay your toes and try to get them opening as easy and gently as possible, with the direct pressure applying that sustained releasing pressure. That's very helpful. Okay, the next way to treat your feet is using a little ball. So this here is my favorite little high bounce ball that my kids allow me to steal from them. You can use a golf ball, although it's pretty hard. But these little devices work very well to get right in between the feet there, in between the toes there. You can see underneath there. Roll around until you find a spot that's pretty tender. Stay on it. Wait for 2 or 3 minutes minimum, preferably longer, up to 5 minutes, until it releases. That is how to use the balls and the Nola roller. Rolling pin or frozen water bottle works fine too, as a way of releasing tension from the feet. Remember, find the spots that hurt and stay on them. It's good to do underneath the dinner table, sitting watching TV, or even just brushing your teeth at night. Do a few minutes on the ball. So the principle that we're working with here, that I promised I would share at the end of the video, if you are a myofascial release therapist, you obviously don't need to listen to this part, but if you're not and you're wondering why we would want to poke into the points that hurt the most, this is a concept of connective tissue and fascia that, under direct sustained pressure, providing it's gentle enough for your body to relax onto it, it'll release in time. That pressure creates what's known as the piezoelectric effect. Piezo is a Greek word for pressure, electricity, that as the ball or some other form of direct pressure presses into tight tissue, it doesn't give and it's pretty tender. But gradually over time, what ends up happening is that the soft tissue melts around that pressure, and there's an increase in bioelectrical flow in that area, which is very good for blood flow and lymphatic flow. When you press into, with the ball or any other, the Nola roller or any other direct pressure tool, we love the foam roller, and I have a video on that also. It shouldn't be tender. We should be able to just roll through the tissue. The movement is searching, looking for the areas that are tender, and you stop where it's most tender and thick and tight, providing you're not directly on a nerve or a bone. If you're still on the soft tissue and it just doesn't give around the pressure, then stop and wait there. Stay stationary for 2 or 3 minutes at least, and then gradually what will happen is, kind of like cheese melting over a burger, it will soften around that pressure, and you'll feel a release, feel like somebody let some air out the ball, which obviously they didn't. In this case, took the little fishy out of the ball. But Scott Van Niekerk from Wholistic Physical Therapy, and our website is holisticphysicaltherapy.com. We have Myofascial Release treatment centers located in Brewster, New York, as well as in Midtown Manhattan. Glad to be of service. I hope you learned something from the video. Enjoy watching.